Welcome back, ladies and gentlemen. Today, we were diving into the fascinating world of pregnancy urine test accuracy. Have you ever wondered just how reliable those little sticks are? Well, you're in the right place. In this video, we will explore the ins and outs of pregnancy urine tests, from the accuracy to the factors that can influence the result. So, let's get started. Understanding pregnancy urine test. Before we delve into the accuracy of pregnancy urine test, let's take a moment to understand how they work. These tests are designed to detect the presence of a hormone called human chronic gonadotropin, or HCG for short. This hormone is produced by the placenta shortly after a fertilized egg attaches to the uterine lining. As HCG level rise, it becomes detectable in a woman's urine. Factors influencing test accuracy. Now, let's talk about the factors that can influence the accuracy of pregnancy urine test. It's important to note that these tests are highly reliable when used correctly, but certain variables can affect the accuracy. Tip number 1. Timing is the key. The timing of the test plays a crucial role. Most pregnancy urine tests claim to provide accurate result around the time of your missed period. However, taking the test too early, even before your missed period, may yield a false negative result. It is advisable to wait a few days after your missed period for more accurate result. Tip number 2. Following test instruction. Properly following the instruction is vital. Each test kit comes with specific instructions that should be carefully read and followed. Failure to follow the instructions, such as using the wrong urine sample or reading the results too early or too late, can lead to inaccurate result. Tip number 3. Sensitivity of the test. The sensitivity of the test also matters. Some tests are more sensitive than others, meaning they can detect lower levels of HCG. Highly sensitive tests can provide accurate result earlier in pregnancy, while less sensitive tests may require higher level of HCG to be present for a positive result. Interpreting test result. Understanding how to interpret the test result is essential for accuracy. Most pregnancy urine tests display two lines, a control line and a test line. A positive result is indicated by the presence of both lines, and regardless of how faint the test line may be. A negative result is shown by the presence of only the control line. It's important to remember that any line, no matter how faint, is considered a positive result. And that wraps up our exploration of pregnancy urine test accuracy. Remember, these tests are generally reliable when used correctly, but various factors can influence their accuracy. If you are unsure about your test result, it's always a good idea to consult with a healthcare professional for confirmation and guidance. If you found this video helpful and informative, be sure to give it a thumbs up and subscribe to our channel for more valuable content. We appreciate your support. And as always, if you have any question or suggestion for future videos, please leave them in the comment section below.